Good afternoon, everyone. Talking about data analytics, our amazing technical support team have just advised me that there is a 98% chance that my speech notes will appear on that screen, which means that there is a 2% chance that they won't. So here's my backup plan. Okay, we saw some really amazing presentations this morning, and quite frankly, a very hard act to follow. We saw example after example of amazing new technologies coming into health and starting to be used in our clinical institutions, in some of our leading clinical institutions, which is just fantastic. Now, for a guy like me leading a statewide e-health agency, the key question I'm thinking about is, how do we scale these innovations across the entire health system? How do we make New South Wales Health fit for digital future that we are talking about today? So this session will be really more from that system-wide perspective, both New South Wales and, as you will hear from Dr. Bryden, also national perspective. Now, to start with, I need you to imagine with me for a moment, which shouldn't be difficult after what you saw this morning. Imagine a future in which 1/4 of all healthcare services are provided online rather than face-to-face. A future in which patients have control over their personal health records and can use virtual assistants and chatbots to make appointments with health professionals. Patients can select whether they want to interact with providers via video consultations, home-based services, or by visiting their nearest community health centre. In this future, a health system such as New South Wales Health proactively identifies patient groups and communities to whom it needs to provide comprehensive, targeted healthcare interventions to prevent deterioration of illness and to avoid emergency department presentations. And when an ED visit is in fact needed, the patient initiates that process from their smartphone, and the healthcare team greets them on arrival to hospital before they commence the diagnostic and treatment process, tailored to their need and without delay. And if the patient is brought in by ambulance, the ambulance is able to stream patient information and key vital clinical records on the route to hospital, so that the hospital team is prepared and the transfer of care is smooth and seamless. Imagine a future where cancer treatment is personalized, guided by genomic information and supported by artificial intelligence-driven protocols. You saw an example of that earlier today. With clinicians focused on compassionate care and patient support, because most administrative processes have been automated. This is a future in which the latest evidence is translated into practice every week rather than every few years, where learning, research, and discovery is part of the fabric of healthcare delivery, fueled by big data analytics. In this future, communities interact with their health providers constantly by providing feedback on their health needs, experiences, and outcomes. The patient-reported measures are used to determine value and success of care that they received. And this, indeed, is this patient feedback that guides how services are configured, funded, and delivered. And this enables patients to really be partners in maintaining their own health and well-being, and enables families to achieve their own health goals, like reducing childhood obesity. And it enables all health organizations to be hotbeds of innovation and research, but also to be skillful custodians and stewards of their financial and human resources. Why? Because their innovative culture is supported by enabling user-friendly technologies. Now, are these all images of a distant future? Well, most of these things are possible now, even with the current technology, let alone the new emerging technologies that are coming our way, which you saw this morning. Now, the good news is that we can shape the future. We can pick up the elements that best fit the goals, the aspirations, and the values of New South Wales Health, and set aside those that don't. Now, the seeds of this kind of future have already been planted in New South Wales Health. Its foundations have been built, and its digital architecture is getting clearer and more tangible every day. In partnership with LHDs, Pillars, Ministry, other New South Wales health agencies, Ehealth New South Wales is leading the largest digital health transformation program in Australia. This program has, for example, already connected all hospitals and community health centres in rural and regional New South Wales to our secure broadband network. And what that means for these facilities is that they can now enjoy the same access to digital capabilities like EMR, digital imaging, and even virtual reality, which you saw today. That was not possible without fast, secure networks. We have created a statewide infrastructure for all of the 150,000 New South Wales health employees to be able to access and consume a growing range of digital services through the use of their unique staff member identifier. The electronic medical record system, EMR2, is now live in 152 hospitals, and electronic medication management is live and used every day in 21 hospitals and expanding rapidly. Integration with community-based providers is getting stronger as well. In the last financial year alone, 900,000 electronic discharge summaries were sent from our HealthyNet system to patients' GPs. New South Wales Health also became the first jurisdiction to start submitting pathology results into the National My Health Record. We have also successfully completed a trial in the PN Blue Mountains of an opt-out model of patients' participation in My Health Record, and that is now to become a national standard. Online patient portals are being deployed, and free patient Wi-Fi access is being offered in a growing number of our hospitals. The use of data and analytics is evolving rapidly in New South Wales Health. You just heard that presentation. It is used for safety and quality monitoring, operational management, activity-based funding, population health measures, training, research, and the list goes on. Hundreds of training courses are available on HETI's My Health Learning, and latest evidence from around the world is available at a click of a button through the CIAP system. And this is just the beginning. Next 2 or 3 years of the eHealth program will still be characterized by these heavy lifting activities to build infrastructure, implement new electronic systems, and eliminate paper-based processes. But the next phase of our eHealth journey will be far more exciting as we start to make these systems mobile and available everywhere on different types of devices. They will become more user-friendly, more accessible, and more intuitive. So the future of eHealth is about patient experience, staff experience, and data analytics. And it is about supporting new models of care, integrated, personalized. And we have to say some of these models of care are still evolving. Some don't even exist today. So what does that mean for us from the IT perspective? What it means is that we need to make our IT systems more open and more flexible, so that we can easily and rapidly implement these new models of care, adapt these systems, and make them support these new models of care. And also that we can easily extract data out of our operational systems to fuel data analytics. What it also means is that our IT systems will have to become a lot more standardized and integrated across New South Wales Health, because that is the best way to ensure that we can implement new models of care quickly across the state. And we already see examples of that standardization occurring. For instance, our 6 rural local health districts have recently decided to standardize their drug formularies, which traditionally have differed from one hospital to another. So they've decided to standardize it and implement one single drug formulary across 100-odd hospitals as part of their electronic medication management project. Now, that'll be a very hard thing to do. But the reason they've decided to do it is because it is the right thing to do for patients and for New South Wales Health. A great example of system thinking and leadership. Now, to achieve all this, to reach that next horizon of digital health, we will work in partnership with clinicians and patients as we design and deploy the new systems. that will ensure that these systems are fit for purpose. We will work in partnership with the ICT industry to leverage their talents, resources and technologies in ways that best meet the needs of New South Wales Health. And we will partner with other jurisdictions and with our Commonwealth colleagues to make My Health Record a success, as that will help us develop new ways for patients to interact with their health system. In the remainder of this session, you will see some examples of how these collaborations, national and those with the industry, are making a difference to New South Wales Health and the wider Australian health environment, and most importantly to patients and clinicians who are at the heart of everything we do in Ehealth. It is my pleasure now to introduce Dr. Michael Bryden, Chief Executive of the Sydney Children's Hospitals Network. Thank you.
Thanks, Simon. G'day. I'm Michael and I'm a simple guy. And just to prove it, this is the implement they've given me to change the slides. It's got a green button for forward and a red button for backwards, and it was so complicated, Paul outside who mic'd me up said, "You've got the Madonna mic on, you can be trusted with that, but you're not going to get this until you're walking on stage." I thought that's a very good start to the talk. But one of the things about coming to work each day is I'm really proud of the people I work with. You know, you saw the talents of Zoran. You know, he's all over Ehealth on a national front. You heard earlier from Cheryl McCulloch and her team. Inspiring, driven, wonderful people. But there's also another gentleman who's not up here today is Steve Badham, who has done a lot of the project work behind what I'm going to talk about, and I want to acknowledge him and his team. The thing about the project I'm going to talk about is I'm just going to ask you a couple of questions first, and I'm going to use a new technique that some of you have not been familiar with before, and I'm going to ask you a question, and if the answer is yes, what you do is you put your hand up. Okay, that's a thing called show of hands. And for those of you who weren't born last century, I know this is a new concept, but let's do something. I want you to put your hand up if you work in New South Wales Health. Great. Keep your hand up if you know where your immunisation records were and you could easily find them when you were required to do that. Keep your hands up if you were easily able to access your immunisation records. The minority. Another question. Who's got children under the age of 36 in the audience? Keep them up if they were born in New South Wales. I'm going to ask you a question. I really want you to think about this. Do you know where your child's blue book or child health record is exactly, right at the moment? You sure? Okay, I'm going to be honest with you. I had my hand up yesterday. I had to take it down today. Thank you. Why? Because I went to try and find one of my kids' blue books this morning. I knew exactly where they were, and it's gone. It's quite an interesting concept. We've had this wonderful system in New South Wales, the Blue Book, which records a lot of the very important data about a child in their growing up period. It's all written, it's often getting lost, and it's not an enduring document. After a few years, it starts to look pretty poorly. So people around Australia started thinking about this a little while ago. And in other states, it's not called the Blue Book, by the way, it's called the Red Book or the Orange Book or the whatever. And the people who were putting the content together were saying, well, shouldn't we have a national version? We've started calling that the Rainbow Book. A national version. And wouldn't it be wonderful if that version was electronic? In this day and age, wouldn't that be amazing? It's not that difficult. What's been holding us up? It's certainly not the technology. Technology is way ahead of this. It's actually about that implementation phase, and this is what excited me about getting people together collaboratively to start using the tools that are available, and how do you get them to play? And this is the project we started on. It's been a whirlwind year, I have to say, and I'll explain that in a moment. But it all started with a simple conversation with a gentleman called Tim Kelsey, who runs the Australian Digital Health Agency, and Zoran and a couple of other people from around Australia, and said, you know, here's a really good opportunity for the Australian Digital Health Agency to do something that Australian children are screaming out for, and we'll set them up for a long period. So we got a lot of people to start talking. And when we started looking at an idea, we said, here's a vision. Read that vision. Does anybody in this room think that's not a thing you could sign up to? Anybody? I think it's a wonderful vision, to make Australia the best place in the world to raise children and young people, and to be raised. It's a no-brainer. So when you get people together, if you have a very clear vision and they're all signing up to it, and you're saying, we're going to use the IT digital tools of today and we're going to have that as our goal, and you bring people together, it is an amazingly fertile discussion. But you need some sort of process. You need partners around that discussion. So we got all the jurisdictions from around Australia and some other key national groups together really quickly. Australian Digital Health Agency gave us some project money to get people together. And like all good managers, we set up a structure and a project team. And just to most of you be aware how difficult it is to get people together, the first meeting of the working party to set up the steering committee was in late February, early March. And all that structure underneath it, with multiple people engaged, has occurred and reported back in August to the Australian Digital Health Agency with the product. And that's quite an achievement. I'll come back to that to show you why. That blue line there, where those project teams are, we actually gave them a green field with that vision and said, go away and think about it. What could we do in this digital health space that would really bring value to children? Obviously, I was pushing the blue book or the rainbow book, but others had their own ideas. And we had groups meeting. We had it was quite an important step in the whole project. There was only one seriously big meeting in Sydney. Most of the meetings actually occurred in every other state, even though this was a project that was auspiced by New South Wales Health and the Sydney Children's Hospitals Network. That was a game changer because people could see we weren't trying to monopolise the process. We worked really hard to make sure that this was a national process, and the meetings occurred in every other state, and we used technology to sometimes facilitate that. This was the sort of rich information that came back from those multiple blue meetings. We got a group of people together after this to try and bring them together as themes. We ended up with 5 themes, which I'll come to in a moment. But some of the topics up there were standard. You know, we want to create an e-blue book or an e-rainbow book. That was almost over the line to start with. But others said, why is it a health book? Shouldn't it be a well-being book where all the agencies like education and social welfare and others can put the information about the children as well? That's very ambitious, getting agencies to cooperate. What about the adolescents? Do you know, in Australia today, you get all your immunisations before school locked into the system, and then there's another system through the education system that locks in those immunisations given to school. It's not recorded in the one spot, and it's certainly not easily available to you electronically. When you get to 18, you all of a sudden go to apply for jobs, particularly in the health industry, and you've got to find your immunisation records. And they're in 2 different areas. And if you're 40 years post-school like I am, it's a bloody hard job to even find the school. So you've got these sort of problems ahead of us, and what we're trying to do is set up for success in the next 10 to 20 years to make it easier for immunisation records. So they were sort of things. How do we connect the school immunisation to the preschool immunisation records? There were other things about pathways, bringing ideas to the table. where that we would be able to use access pathways or clinical pathways or developmental pathways where they would be available electronically stored and able to stimulate people to attend where they're supposed to attend on the time they're supposed to attend, using technology that is clearly well available but not being used at all to actually remind people that you're due for something. There were other parts of this that were just saying, boy, there's a lot of stuff going on out there, isn't there? One of the ideas was just get a map of everything that's going on. Another was to say, okay, well, if we've got access to all this data, I bet you the researchers would be interested. And of course they are, because once you start getting this sort of digital held record of at least health and possibly the other agencies, it becomes an enormously powerful tool for public health measures and other reasons. So having put a lot of work into that, we ended up with hundreds of people actually face-to-face engaged, many others engaged through webinars, and we set up particular areas that we were interested in for topics like Indigenous health, topics like adolescent health, topic like maternal health, so that we could actually make sure we've captured the items that people would want to know about with children. Things like, can we get the pregnancy record to link with the child health record? Wow, that's a revolution. It's the same baby. So that's a very important part of the well-being, and as you mostly would hopefully know, is that a lot of your life is set up in utero, and what happens to you in utero is actually a very important part of public health planning. So we've got to capture that in a way that links in with the child's record so that we can follow that through the system. So I'll just go back to that for a moment. We ended up with 5 themes, and the 5 themes, clearly the child health book was the infant book, the developmental area. We also said it should go through into the capturing the milestones through children. We're going to bring the immunisation records together. We had a theme around the pregnancy area as well, which is not the usual playing field for children's health, but it was so important for the children's well-being. So we wanted to bring that into a theme, and of course the research theme. The 2 matrixed areas there are the health pathways and the, can't even read that now, the literacy. So the literacy that we were going to use these tools to be actually make sure there was an educational opportunity in the products themselves. That yellow box at the bottom didn't get up in the first iteration, but it's on the horizon. And it's very important we keep it on the horizon, because when you build something in an IT framework, you've got to know where you want to be, and you've got to make sure you capture that idea so that interagency cooperation is being built into the concepts early on, not try and modify it later. So we've planned it that that's a possibility, but we're not at this stage going to do that as a project. Too tough. And the final area was, how do you map this out? So we're starting off with the prenatal period, we're working right through to the 18-year-old, we're doing it in stages, we've got a 2.5-year game plan, and we're going to pilot each of those 5 areas over the next 2.5 years. But you have to promise me something. Everybody here, it has not been announced, so when you hear an announcement about this, you've all got to go, oh my goodness, that's fantastic. So when it gets announced, you please keep that to yourselves until then, but it is likely to get announced. And I'm really pleased that we're using collaboration, we're using people to use standard things that are available widely, and we are going to set up the future generation to be the best place to raise children. So thank you very much.
Type innovation into Google and a mind-blowing 655 million results appear. It's a word that's used by many people and means a lot of different things to everybody. My name's Fahud Salimi, and I'm here to tell you how Ehealth New South Wales is working with our partners within New South Wales and external to it to harness the power of innovation. In doing so, we aim to turn light bulb moments into digital solutions for the greater good. The way we've been doing this is through what some call the art of listening. We've been listening to you, who work at the front line of healthcare every day, and with your help, we've compiled a hit list of 9 challenges facing New South Wales Health today. What you've shared with us is at the heart of our efforts to innovate for the clinicians and the patients of New South Wales. Here's what some of you had to say about what innovation in digital health means. Take a look.
It really means working at the edges. It means working at problems, bringing people together around problems that are often difficult to solve, but require a creative solution.
So innovation in digital health for me is really where we can make a shift that's bigger than what we've done in the past. In the past, IT transformations have been kind of iterations, a slightly different take on what we're already doing, and really putting IT into the delivery that we already have. And I think innovation is where we can take a real big leap away from what we're doing now and deliver it differently, hopefully in a more affordable and efficient way.
So innovation in the digital health space to me means taking an old, often entrenched problem with a creative view, flipping it on its head and solving it in a new way. And to me, often that's enabled by technology.
Digital innovation in the healthcare space means to me a better able to manage my patients in an intensive care unit and in the hospital environment. Able to access information quickly and accurately digitally is of prime importance in managing patients and being aware of their histories and what is happening to them in real time.
Really, we're in the middle of a data revolution. So we're at a point in history where we've created more data in the past 2 years than we have in the entire preceding history. And so in the health space, what this means is that we have access now to huge and vast amounts of complex data, such as electronic medical records.
Well, innovation in the digital health space is really important to education and training, because our health workers have expectations that we'll keep pace with innovation.
Innovation in the digital health space, to me, means using technologies to enable healthcare services to deliver new services, new models of care, and deliver care more effectively and more efficiently.
What I like about that is that there were no 2 answers that were the same. It's about working at the edges, taking an old problem and solving it in a creative new way. It's only by knowing the challenges we face, that we can help design digital solutions to address them. And so we've developed an innovation portal in which ideas can be submitted by our partners in delivering healthcare. In that portal, we take those ideas, we prioritise them, we capture them, and then the best of the best will be used to partner with industry. Some of these challenges are way too big for one organisation to deal with. So that's why we're partnering with all our industry partners. And we've had a lot of feedback about that partnership. Again, I'd like to share what others think about that.
The partnering with industry is absolutely critical. The value of bringing different partners together is that you bring different perspectives. So innovation happens out of that amalgam, that mix of different views, different ideas, different experiences that come together to give you a solution that you wouldn't get with just people of the same backgrounds, the same things.
I think it's exciting, it's scary, and it's astute.
For us to partner with industry and have a new approach to how we get the collaborative discussion going and a means to transparently understand what our big priorities are is key.
I mean, the more people who are involved in this discussion, it's better for innovation to occur. We really need to, solicit wide stakeholder engagement to make these types of innovation possible. And so getting wider market input from small to mid-tier companies is really important.
I think that from an eHealth perspective, when they do integrate with the industry partners like Cerner, a lot more benefits and focus on the clinical outcomes and the innovation are going to occur, especially with the partnering with the local health districts who are going to drive the clinical change and values directly to the clinicians and the patients around New South Wales.
Ehealth's partnership with industry is absolutely essential to learning the lessons from industry and applying them to the healthcare sector. Industry has been doing this for longer than we have. and we need to learn from them.
I think it's really important that we broaden our partners so that we're getting experiences from those other industries. It helps us move faster, but it also helps us look at things differently so that we can see things perhaps more in a business-like approach.
As problems become more complex, I think these partnerships are key to solving them.
Yeah, I think it's really critical that we partner with industry, and we need to think about how we use and leverage the abilities that we have, the experiences we have, the knowledge that we have, and partner with industry to think about how we can make even further gains in the way we provide support for those improvements that will enable us to deliver better patient care.
We need to innovate with companies who can stretch our imagination and assist us in our thinking about what is innovation now, what is it going to look like in 10, 15 and 20 years, because that's where our thinking needs to be.
Wow, everyone thought it was a great idea. How much did you actually pay them, Zoran, for those comments? But seriously, as you've heard, partnering is critical to bringing diversity and different perspectives to solving problems. The more people who are involved, the better the outcome. There's no doubt about that. As Dr. Lancashire pointed out, other industry partners have been doing this for a lot longer than we have, and we need to learn from them. Take the industry example in retail, for example. Amazon and Google have been using our using their search engines and the data about where we click and what we buy to present other aspects of the retail journey to their customers. Just imagine, as Zoran said earlier, if we could grab that information from a patient before they turn up in ED, route them to the right place, make sure that we're set up behind the scenes to receive that patient and customise the patient journey as it comes through, or personalised for that matter. The possibilities are endless. I'm not the only one who's excited about these opportunities. One more video before we finish.
It's a very exciting time to work in healthcare. The multitude of innovations across all sectors are starting to come together, and the foundations are there for us to really capitalize on new innovations into the future.
We're not going to practice healthcare the same way we've practiced the last 10 years. And in 5 more years, healthcare is going to change again. So we have to constantly be on the edge of technology and healthcare as an intersection.
Moving forward, we'll have one total electronic record for the patient, so the information will be at clinicians' fingertips, which will be great. You don't have to go searching, different systems, paper, electronic, a whole lot of things. I suggest it will stop duplication of effort in relation to tests, so there'll be savings to reinvest back into health. The patient's voice will be in that digital medium. So I think it will create a more efficient service, but also reduce the risk of error moving forward.
I think the big challenge and the big thing for us all to think about is how do you both allow lots of small projects to succeed and fail and try out new innovative things, but also then figure out how to get a transition to deliver on a statewide basis at scale.
And I think what's really exciting at the moment is the space that digital health is now starting to play. How much power it can actually transform from what we've historically done to give patients and carers much more information that can help them drive the sort of care that they would like to have.
What these perspectives tell us is that we're really at a golden moment when it comes to opportunities in innovation in health. With all that data, the machine learning capabilities nowadays, and all the technology that you saw earlier today, the foundations are there, the energy's there, the ideas are there. And we're here to work with you to turn those light bulb moments into solutions for the greater good. It's exciting, it's scary, and it's astute. Thank you.
Great job.